What's up, my YouTube family? How y'all doing? I'm Alondra Ishtar, and welcome back to another video. So if you read by the title, this may not even be the title, but if you read by the title, because it might be the title, what you need to know when going into clinicals. If you're wondering what I'm looking at my good old notebook. So this video shouldn't be no longer than 5-10 minutes. But my first thing you need to know, don't be nervous. Now, that says a lot coming from a person who cried on their first day of clinical. But I promise there's nothing to be nervous about. If y'all go back and watch my video, that was just dramatic. You know what I'm saying? It's just the special effects. You know, I had to put on the waterworks for y'all. I mean, otherwise y'all wouldn't have watched. Now, another thing. You will have a person called a preceptor. That's going to be the person you shadow. Now, if you're like me, I had 3 of them. I mean, you never know who's going to be your preceptor. So that's going to be the person you shadowing. Now, they're going to let you do some things. Or sometimes you may have to tell them if you want to do something. You have to take initiative and tell them what you want to do. Now, 3, make sure you know your stuff. You're going to have to do vital signs, sticking people, venipuncture, shots. So you want to make sure you know what you're doing. You want to make sure you know your landmarks. So like if you're giving the flu shot, you know this is your chromium process. You know that you go 3 fingers down, shot. And for venipuncture, you know that you wrap the tourniquet and then so you have to know your skills, because once you go there, they think that you know your skills. So they're going to put you on the spot. And if they don't, you tell them that you want to do something, because obviously you go in there to get graded. So you tell them. So yeah, know all your landmarks, know how to do stuff. So when you go into a patient's room, it's different from a clinical and a nursing home. We were supposed to be in the nursing home this semester, but COVID. So, nobody's wanting people with their grandmas, grandpas, moms, sons, daughters, whatever. So in a clinical setting, they go in, they ask questions. Now, those questions, they're going to be throwing a lot of questions at those patients, questions that they don't teach us in school. So when I first went in there, I was just like, how are they getting all these questions off the dome? You will learn those questions. Basically, the questions are based off of their database on how they document. Me, I still don't know the questions, but I know some of them. I know that they ask, what are your allergies? They'll tell them a medicine. They'll be like, okay, what's your reaction to that medicine? Like, I thought I was allergic to, it was something they gave me at the hospital, but because I started itching. But that's a side effect of that medicine. That's not an allergic reaction. Morphine is what it was. That is a side effect. That's not an allergic reaction. That's why we ask people what are they allergic to and what's their reaction to it, because their reaction could be a side effect, not an allergic reaction. So those are the type of questions they ask going in. Of course, you won't know that, but you'll learn it when you go to clinical. There's 2 different types of clinics. You have urgent care and you have family. I'm in family. They're going to make appointments coming to these facilities. Going to urgent care, they're not making appointments. They're just coming in and out, in and out, in and out, in and out. So your questions will be different based off for those 2 facilities, because these families, these are established patients. From those urgent cares, these are people just coming in and out for acute things. Like, acute things last less than 6 months. Chronic things are what they kind of see in family medicine. Those are things that last over 6 months or for a lifetime. So things like you can see like high blood pressure or diabetes, things like that. But you see at an urgent care, you'll see things like, man, I got a paper cut. Well, now hopefully they don't come in for a paper cut, but those type of things. If you had a patient with pain, you'll tell them, this will be a question for like with pain, and I actually learned this and I thought it was so cool. So you'll ask them to rate it 1 to 10. You can ask them, does it radiate? So some people will say they have a back pain. You will ask them, does it radiate down or does it radiate up? And they'll say neither. Okay, that's pinpointing the pain. And yeah, so let's go on to the next step. Some patients will be rude, but I have learned, and sometimes you may like your clinical setting, you may not. But what I have learned, you have to go in there with a positive attitude. It'll make everything flow better. You'll make your day better, make your weeks better. It helps. So go in clinical with the best attitude ever. I was in clinical for 9 hours, and though I may not have wanted to stay for 9 hours, y'all, that's a long time. Make your attitude, and make your attitude better, and it won't even seem like 9 hours. All right, know your medicines. Y'all, when I tell you these nurses be knowing their medications, and I thought they looked in the book, but no, these nurses actually know the side effects of the medicine. They know the medicine. Now, sometimes if they really don't know, they'll look it up on the computer. But you want to know your medicines, y'all. I guess that's the importance of pharmacology. So when somebody say, I take something like lisinopril, that's a blood pressure medicine. And so these nurses know the side effects. They know what it's for. Sometimes the patient will ask you what it's for. And you have to know. Sometimes your teacher may say, you in the nursing home and you taking care of this patient, they'll say, what are 3 adverse reactions of this medicine? What is this medicine for? So you want to know your medicines just so you can get your A. And so you can know what to tell the patient, what to expect. Documentation on some facilities is on, laptops because, we're more advanced. I find clinics much more easier than nursing home, even though I haven't went. But because you have so much more to do at a nursing home, like peg tubes, Foley catheters, what else do you do? Turning the patient, changing diapers. You don't do that at clinics. At clinics, they in there, you tell them what's going on, and then you hand them over to the doctor or the nurse prac. So you don't really do hands-on stuff in the clinic besides your vital signs, your shots. You just basically, those are the basics. So I will be going to a clinic. So not to take the easy way out, but I feel like a clinic is for me. I don't feel like, but you learn the other stuff. I take a journal with me to clinical. Reason being because you see a lot of different stuff. You want to go tell your class what you seen. Like I saw ear irrigation the other day and I didn't even know that was a thing. No, yes, I did know that was a thing, but I've never seen it. So it was good to see it other than reading about it. And I saw that. I've seen TB skin tests. Some things you don't talk about in class that you see in clinical and you want to write about it. And we have to journal. So I journal in my little book. So that's basically what I do. And that's pretty much all I want to tell y'all. But y'all really enjoy clinical. This is my 2nd week. I really enjoyed it. I have 1 more week. And then I'll be on Christmas break and then 2nd semester. So for real, y'all, enjoy clinical. Don't be nervous. Go in there with a mindset. I'm going to do this. I'm going to do it right. I'm going to enjoy my patients. I'm going to have fun. Go in there like that, y'all. And patients love students because they be telling you good luck. They be saying all this encouraging stuff. So go in there with a great attitude. You will do great. You will do fine. All right. I'll see y'all some more videos. Comment down below. Let's go.